glucose, right? No oxygen there. And if we are able to infuse oxygen into the cell, right? All the cancers have low oxygen, less than 25% oxygen. It's a decay. And if we are able to do that, then I think they can make a progress. Next slide. This oxygen cancer connection, it's on the net. I have my own site also. You can always see the thing. You can Google about this photo barber, and you'll know about this. So tumor oxygenation is one thing which was shown to have a good prognosis. It has been accepted, this particular thing, and this is what we are trying to work out. We use something called ozone therapy. We use something like hyperbaric oxygen therapy to improve the oxygenation of the tumors. Next slide. This was the slide I just wanted to show you. This was a study which was done showing the high levels of mercury and lead and all that in the breast cancer tissue, which was done. Can you just go back? I used to work with this MLM. Eleanor is a pathologist. She works in Germany, madam. She has a microtrace filters kind of stuff, and she has done a lot of work on that. And we were trying to we know each other. We keep exchanging notes and all that. And it's a great kind of stuff which was done. And she is the one. When her husband died, her husband had a pancreatic cancer, and she was able to isolate pancreatic cancer from there. She was able to show high levels of mercury in that, and she's working on glioblastoma multiforme also, and she's able to show high levels of not this particular thing, but she's working on this all phthalates and all that, phthalates and other stuffs and all that. Next slide. This is what next slide. Can go fast. You can go fast. So what I was from the I was trying to put across a picture is basically this is the metal toxicity is one thing, which is we call it as a mimicry, basically biological mimicry, because one person gets into the other thing as a, and this is the way metal toxicity happens, and it's a slow process basically, but it takes certainly a lot of time. And by the time you realize, okay, you are into a disease part and all that, already damage is being done, and it takes, you have to, if you do want to do something substantially, as I was mentioning, we used to do deletion therapy for cardiac patients. Most of the cases were having diabetes, and all of them used to have paresthesias and all that. And they were not all multiple, this one, you are giving thiamine, you are giving all these. The moment we removed the arsenic, and we used to get the kind of response. And I'll show you next slide. These are all available on my net. This is one word of caution for all the junior doctors basically. And please try to tell your patients to resist the temptation. You get a beautiful ad, somebody telling use antiperspirants, use DOs and all that. This is causing more damage here. This is all antiperspirants has got aluminum in that. It blocks your sweat pores. From the sweat pores, it can travel into any appropriate gland, right? Your breast is the extension of the appropriate gland. And this is what exactly the parabens. Next slide. Chromium, we were doing some work in Damarchelra. It is in a district, Nalgonda district, sir. Damarchelra is a place where one of my friends, Dr. Babura, has done a lot of work. And all the hexavalent chromium, which was picked up from the industry, is being thrown into the water canal. I have slides not here as such, but when we showed this to international these people, they said this is just nothing but genocide. Sir, a water stream like Musi, you throw this hexavalent chromium into that, the whole thing is being contaminated. And hexavalent chromium is one thing which is causing, it is bound to cause mutations, it's bound to cause, it already proved to cause a carcinogen. You should see a movie called Erin Brockovich. Try to Google it and see that particular movie. Erin Brockovich movie has, this thing happened in California, where there was a, near a canal, there was an activist
who was not even a doctor, madam. I think Brokovich was not a doctor. She was a lawyer, something like that. She was aide to a lawyer, and she won a case. And in her colony, all the people who got there used to be a lot of high levels of cancer and all that in the vicinity. And she was the one who picked up the water supply, the canal, as having the effluents was thrown by a big GE. There was a big company, and they claimed the kind of things as such. So I'm trying to put across here, this is a big issue actually, and we see in every apartments, we are probably living in all the apartments and all that, and we see one or two cases are there always, and this is a huge, this is a kind of concern as such, and it is there here. It is like we have to look at a lot of things as such. We have to look our building has got some cell towers or not. If we have got cell towers, we are going into our transmembrane potential, whatever I was explaining, it's going to go further down, and your detox skills are going to be totally out of balance actually. So we have to work on all these stuff. And I will definitely appreciate my work. I still have not yet given you a complete view, but I'm into that one. I just feel that okay, we need to look at the cause and need to work out because we have already ample evidence. We have I can always show pancreatic cancer caused by cadmium, and there is already a talk rice has got cadmium. See, I try to work from my experiences. When I was in Durga by Desmukh, I used to, my Pedanana, my father's elder brother, he had a gangrene of the second finger. And the dermatologist told, okay, we will remove that. After that, he had one more finger, he got a gangrene. Then I was looking, what is happening here? Yeah, let me see. Then we started looking, there was a diffuse peripheral vascular disease. And we thought, oh, it's a diabetic thing and all that. So, see, why I'm trying to put across is that it took me 6 months or some time for me to understand because my Pedanana, he was an ardent Chyawanprash eater. Daily morning he used to take 2 or 3 scoops of Chyawanprash with milk. He had a good quality of life except for that particular thing. Now we understand. We thought of that time only that Chyawanprash was having full of lead, gold and chandi. It is Sona Chandi Chyawanprash is being marketed, sir. Sir, if we start taking these things, we are bound to get into problems. This purple basket, we started doing detox and we started doing working well. Okay, but it's a kind of thing. I'm just giving you a kind of example. And similarly is with the rice now. We have to be careful with the rice. We just can't take it rice like that. In US, Indian rice is absolutely no matter. Indian Indian Arabic drugs has high levels of lead in that, high levels of mercury and other stuffs and all that. I don't know why these people are making that particular thing. They just want to because it is people like us who are put on shame basically. Somebody with doing some siddha, he says, I will give heavy metal to treat this particular thing. We understand, arsenic was treated for acute lymphatic leukemia some time back actually, but not now. Already your levels are full. You give something else, some more, your kidneys are going to get shut down or you are going into major disaster. So I definitely like to take some questions because I don't want to go monotonously because it's a big subject as such. Any questions around that? I can go on and on because we have able to work on non-Hodgkin's lymphoma. We were able to show the pesticides. You can just scroll it. People for their thing they can see actually. Non-Hodgkin's lymphoma, there's a big association. Parkinson's disease now we feel is because of its environmental disaster. We are talking about Alzheimer's disease. This is type 3 diabetes now. Alzheimer's disease is aluminum toxicity. Aluminum toxicity, I've been giving a talk in gynecology with Foxy last time, and I was talking to most of the gynecologists. I asked how many of you use aluminum vessels? No, we don't use it. The next question was, I framed my thing as how many of you using pressure cookers? Everybody is using. Pressure cookers are still being used. Please don't use this kind of stuff. Don't ask your patients to use this. because we have to work on that. The big can cause simple things can make a lot of difference. I've been working on at high level, but we are trying to work on a bigger level. We have approached Union Health Minister also. He appreciated our efforts actually as a group, what we are trying to do on environmental medicine, and he has sent me a beautiful letter. And he said, not every doctor knows. But I said, see, I was not knowing all this stuff before. I did my MBBS, I did my radiology. I was a pension. I used to be a voracious reader. I spent a lot of time in BL as well as other libraries. But I feel after the internet and all that things have become easier. But how a normal person without any knowledge, when a doctor doesn't know about this aluminum and this chemicals disasters and all that, how can you expect a normal person to have this? So our motto is basically to spread this knowledge, and I feel all of you are ambassadors. I can give all this data. I have treated lots of patients. I feel that I can treat only this much. There's a lot of things as well. If I can impart knowledge, try to look into things as well, because see, something is at stake, our nation is at stake, our health is at stake. I felt I need to replenish my energy, I need to rejuvenate myself. I was not 10 years back. I was getting sloppy. I thought, chalo, aging is catching up and all that. Chalo, my other peers and all that said, nay, you have to be careful. Now you can't do so dynamic. But I tell you, I keep detoxing myself. I keep doing some oxygen therapies and all that. I'll tell you, touch wood, I do 12 hours. I'm active in my life for 12 hours. I keep giving talks and all that. I feel that, see, if we are not able to utilize this one, we have to first of all get better ourselves, then we can always help others. And detoxification helped me at my personal level immensely. I used to have chronic sinusitis, multiple chemical sensitivities. When I was in medical college, my ENT pros, even ENT, anybody, I had taken Novavax or Novavax for so many months or time like that. Before exam, I used to take quaternion drops as well as Novavax. So all antibiotics I used to take that, and I used to think that was the only answer. For the last 7-8 years, I'm not on any antibiotic at all. I'm absolutely free of some things. I understood definitely this is what exactly. Somebody told me, no, your hypertrophy terminates and all that, try to remove that. I told him this is not going to happen. This is my, let us try to avoid this multiple chemical sensitivities. Try to work on sulfur and methylation. The moment we balance that sulfation problems, everything goes up. In the process, I started looking at other things also. We started working with anti-aging, we started working with ozone, we started working with some complementary therapies also, which was not this one access. For that reason, I took into alternate medicine also. I did my fellowship, I did my Royal College of Alternate Medicine also. But I was passionate. I thought, let me find out some answers. And we somehow feel we are challenging, not like that. We feel that whatever therapies, whatever things we have done, it just cannot be limited to just stent or something like that. And we tell you, change your lifestyle, you try to be less stressful, and that's fine. I don't think this is going to work. We have to complement. Okay, there are some good therapies, right? Bypass is done, good. But what is we have to do at the microvascular level? What we are going to do with the lipid peroxidation? Unless we are working on the lipid peroxidation, this is the air. Now we are able to find out the air pollution. There is some things like dioxins and all that, which causes LDL to peroxidize early. So even if you have a normal LDL, this is peroxidizing and trying to get attached. This is what exactly is happening. So we have to look at the things at a big level now. Cancer, I think, is one thing which I somehow feel it should not be a big, if we can understand the basic cell physiology, if we can work on things around. I have a lot of cases, I'm still dealing with some cases now, a lot of things. And Dr. Sudha, any questions? Maybe. I can go on. here we feel that this is what exactly is going to in the later kind of. Madam, you have to say anything. This was the case actually which we picked up. This was a cancer case, and they went for a chemo and all that. After that, they went for aspirin also. And during this I picked up in 2008. Her husband was a doctor, and he told no, we can go ahead with the toxicity as well as oxygen therapies. And I did show him the papers which showing this particular stuff. And this is what is she now. She had a breast cancer with metastatic breast cancer. Already there was a spread in the spine was there, and so mastectomy was not done. She had a lump of 5 centimeters, something like that, and mastectomy was not done. She went for chemotherapy. She went for radiation for the spine. Then she turned on to our things and all that. I can tell you the patient, they stay here only near Gandhinagar, and now the patient, the lump which was there on mammogram and which used to be fed, there's no lump right now. And this is the 5th year of follow-up. 2009 I picked up, and 2013 we got another this scan. Every year we are getting her bone scan.